Hi everyone, welcome back to another video. My name is Shamira if you are new to my channel, and for those of you that have already been subscribed to me, I know I've been gone for 2 months. I'm back and I'm excited to do this video. So I have a day in the life of a medical coder video. While I was working, I decided to write down some of the procedures that I coded today, and I will be sharing those with you. I'm not going to go through all of them because, to be honest, my son is about to wake up probably in the next 20 or so minutes. So I'm going to try and record as much as I can and then get this video up to you guys. So again, we are just doing a medical coding video. I hope that it's going to be helpful to those of you that are pursuing medical coding, and I hope that you learned something. So I'm just going to be writing down the procedures, and then I think at the 2.5 minute mark is where I'm actually going to go over everything that I coded. So the first half is just basically some work from home, a simmer, and you guys are watching me code. Alrighty, let's go ahead and jump right in. So the first office procedure that I'm going to go over with you guys was a Nexplanon insertion as well as an IUD removal. So this patient had came into the office and had this procedure done. So we're going to be looking at 11981, and here is the explanation of how that procedure is done, as well as some coding tips underneath. So this is going to be for the Nexplanon only. We're going to be building another code for the IUD removal. So our ICD-10 code, which is our diagnostic or diagnosis code, that's going to be Z30.017. So those are our two codes. We have our ICD-10 code and our CPT code for the Nexplanon insertion. And then we are going to need to look for our IUD removal. I did turn the page because I wanted to see if they included the HCPCS code, which is our drug code for the Nexplanon. You don't want to just bill for the procedure if the office supplied the actual drug. Either the patient will bring in the drug and have it go through her insurance. If that is the case, then we wouldn't bill for it. But if the office is supplying whatever's being administered, then we do bill for it. So because this is like my OBGYN coding companion book, I can write the drug code for that in here. So that way I don't have to flip back and forth between this book and my HCPCS book. So if you're somebody that is new to coding and you have a specific specialty or something like that, or there's like frequent codes that you use, feel free to write them in your book so that way you don't have to flip back and forth, especially if the codes are not changing, you know, with the yearly updates and things like that. So that is our 3 codes actually. We have the insertion, the drug, and our ICD-10 code. So now we are going to look for our IUD removal code. We need the CPT and the ICD-10 code. And that is going to be almost there. Right here. So for the insertion, it's 58300, and for the removal, it's 58301. So that is the second CPT code that we're going to be billing. And then we have some explanation of the procedures as well as some coding tips. And then there were also some diagrams at the top, so that way you guys can see kind of like the placement of the IUDs. But down below is the explanation, the coding tips, and then we have our common ICD-10-CM diagnosis or diagnostic codes. So we are going to be using ICD-10 code Z30.432, which is going to be on the right side. Feel free to pause the video in case you want to read all the information that you see on my screen here. But yeah, so the ICD-10 codes are going to be Z30.432, which is up top here. I was just letting you guys see the RVUs and Medicare edits that they have here in this chart. And here are those codes right there. The second one from the bottom is the one for the removal. And then here is my HCPCS book. And as you see, it's from 2016. This is the book that I used to study for my CPC, and I haven't needed to buy another one since. The HCPCS codes that I use on a day-to-day basis, I have on like one of those electronic sticky notes on your desktop. So I have about 4, maybe 5 of them that I use for contraceptives, and I just go to that sticky note to find the code that I need. So for a Nexplanon in your HCPCS book, you will go right here to J7307, and it says use this code for Implanon and Nexplanon. So that's interesting. I actually never seen an Implanon, but we definitely do the insertions for Nexplanons. And then up top there are the codes for Mirenas and Lilettas. And as you guys can see, these codes are still the same in 2025. So there's really no need for us to get a new book. Now, obviously, if there were changes to the codes, then I would just update my sticky note. But I'm not going to get a HCPCS book. My employer is not going to buy them for us. If you wanted to look it up in the index, you will see that you have to go to the table of drugs. So in the back of your HCPCS book is where you would search for Nexplanon, which is right over here on the right hand side. It says Nexplanon, implant, other, and then J7307. So that's how you would officially look it up. And then you can go to where we started, which is the tabular list, to confirm the code. If you're looking for Mirenas, you would just see it's right over here, and there's 2 different options, the 3-year duration and then the 5-year. My office always does the 5-year, so we use the J7298, and I think it said that the Lilettas are the J7297, so they may be a 3-year. But I rarely use that one when I'm coding. So that is it for HCPCS, and we will hop over to our next one, which it looks like the second one down is a circumcision, and those are our codes and our ICD-10 code. So in my OBGYN companion book, I'm trying to see if they actually have the circumcision, even though it's not in the female genital system, but OBGYN providers actually do some of the circumcision. So I'm just checking to see if it's in here, and it's not. So it goes from 53 to 55. So I will have to grab my CPT book. Okay, so here we are, and we will just jump to the male genital system. So whenever you're practicing like coding, it's good to kind of like think, okay, like where in this book would this be? What part of the body are we going to be doing a procedure or surgery on? It's very, very helpful because this book can be kind of confusing. You feel like you have so much information being thrown at you, but if you just kind of like think about it, we're doing a circumcision, so we would want to be in the male genital system. What part of the body of the male genital system? We're going to be working on the penis. Is it an incision? No, we're not really doing a destruction, but it's an excision. If you think about a circumcision, they're removing skin, so that will be an excision. So we should be looking in this area here, and then we find circumcision. It says using clamp or other device with regional, dorsal, penile, or ring block. And then there's also some parenthetical notes here that you want to pay attention to when you are preparing to take the exam, because they do question you on whether you're paying attention to this. So maybe you'll have a multiple choice answer that has a 63, even though it says do not report with modifier 63, and then you can eliminate that answer. And then they also say use modifier 52 when performed without a dorsal penile or ring block. So if the documentation says no dorsal penile ring block was used, then you know you need to put on a modifier 52. So those are some tips there. And our ICD-10 code for the circumcision is going to be Z41.2. So let's say you're somebody like me that codes circumcisions kind of like daily. I see them. Feel free to write the code right there for the routine circumcision. So that way you don't have to jump back and forth. The code has not changed for years and years. So it's easy to just write that there and then code it as you are going through your day. There's no need to open up your CPT book and your ICD-10 book every single time because these codes have not changed. So just to show you guys how you would look that up, I do have the ICD-10-CM, the 2025. My employer did get it for me, so I did not have to pay for this. They're trying not to have to buy one for everybody. You kind of had to ask for one, and they prefer we use our encoder. So sometimes I do pull out my book, and then sometimes I do use our encoder, which is basically our books on the computer, and you look them up that way instead of pulling your books out. So I have that option too. That's why I don't have a new CPT book, if you are wondering. But yeah, here we are at circumcision, which is the third column over, about the fourth one up. You'll see it says in absence of medical indication, ritual, and then routine, Z41.2. So now we would just go and look that up in the tabular list in the very back of the book. Which is right here. And I'm sorry if it kind of gets like blurry. I had the camera on a certain setting, so every time I try to like zoom in, it gets blurry, and then when I zoom out, it kind of focuses. So sorry if it's far away, but you can zoom in with your fingers like you would a picture in your photos. So like see here, if I zoom in, it gets blurry, but if I zoom out, it's kind of clear. So if you just take your two fingers and kind of like zoom in, you can do that. But Z41.2 reads encounter for routine and ritual male circumcision. And then there's a tip here that actually was kind of confusing because it says this code should only be reported when the circumcision is elective and was not performed during the birth admission. So I don't know if they're talking about like as soon as the baby comes out, you shouldn't bill for it. But usually this is done during the same admission. Like the patient's requests to have them done, like the mother or father will have them done before they leave with the baby. So that tip was kind of confusing me because they are done during the first hospital admission. So I really didn't worry about that because we code them. So I don't know. Next up, what was next on my notepad? I forgot. I don't know. I guess I'll just have to watch and see where I went and let you guys know. Okay, so we might be doing a colposcopy with biopsy and an ECC. That looks like what I'm looking at here, which is the 57454. And then I do put in like little abbreviations because sometimes you might see in the documentation BX, ECC. BX is the abbreviation for biopsy. And then ECC is short for endocervical curettage. So feel free to write those in your book, especially if you have other, abbreviated terms that you see often. Just write them in your book. So here is where the explanation of the procedure is, because you all know CPT really doesn't give the explanation of how the procedure is done, but here's that information if you want to pause and read through, as well as our extra diagnosis codes that may or may not be useful. We have our RVUs, and then FUD is follow-up days. So that just means how many days after this procedure is done, the provider will follow up with the patient if necessary. And these are 0 global days, so there's no follow-up needed after the patient has this procedure done. I will be sharing an example. I think it's going to be my last example of how you bill within a global period. I thought that one was going to be helpful. So now I'm just looking up those diagnosis codes that I used for that COLP, which is short for colposcopy. It was in the back of the book, R87612 and R87810 were my diagnosis codes. So we're just going to look at those really quickly. And these were the codes that the provider had chosen. After reviewing pathology, I didn't get another diagnosis code from there, so I just went ahead and used the one that the provider chose. So here we are at R87661. In that little red box next to it, it tells us that this is a 6-digit code, so you need to keep following through until you find that 6-digit, which in our case is a 2, and that is going to be for the LGSIL, which is short for low-grade squamous intraepithelial lesion. And then here at R87881, we need another digit because it has a 6 there, even though it's so hard to see it. Our 6 digit is going to be 0 because this was done on the cervix. So the patient was or had a positive HPV testing done on the cervix. So the sample was positive for HPV. So that's R87810. And then I'm just going to skip these 3 and jump down to that destruction of the perianal lesion. And we billed 56501 with modifier 79 because it was within the global period of aconization. And our diagnosis code was anal genital warts. So this was the one that I was just talking about where we're billing within the global period. So I am going to break this down for you in the best way possible. So let's go to the ICD-10 code first, since we already have this book open, which was the anal genital warts. And I'm just going to look up warts, and then we should be able to get to anal genital, and then we'll see our code that we have as our option. So I'm just going to flip there. Okay, so here we are at wart, and it says anal genital region, venereal, A63.0. Why did I say 0 like that? Like it was an Oreo. 0. And then in the tabular list, you just flip through to A63.0 and read any information that could be helpful. But that is the code that we are going to report. So it just says here, anal genital warts. It tells you that this should have 4 digits, which we have the 4th one, which is 0.0. So that's our ICD-10 code. And now we are going to look for our CPT code. So for this destruction of the lesion, I actually can't even remember what the documentation had said, but I know I went with the 56501. And this is destruction of lesions on the vulva, simple laser surgery, electrosurgery. And I know it says vulva, but the perianal, that area is included in the vulva, perineum, and introitus. So because they don't have a separate destruction of perianal and then destruction of introitus, this is just the code that you would report. So 56501. And then I'm going to show you guys the modifiers and first I'm going to show you guys the conization code that we used. So this patient had a LEEP done, I think 3 weeks ago. So we billed 57522, which reads conization of cervix with or without fulguration, with or without dilation and curettage, with or without repair, loop electrode excision. So you kind of read the information in the code before it, but all the information after the semicolon, I think it is that code. You need to drop down to the 57522 in order to get the LEEP conization code. So here at our modifiers, I'm going to be looking at the unrelated procedure or service by the same physician or other qualified healthcare professional during the postoperative period. And this is modifier 79. My pen's kind of moving faster than me, but it's pretty much just explaining why you would be reporting modifier 79, giving you an example for that. So we are going to be looking at 56501, like I said, but I may be showing you guys 57522 first in this book here, which was that LEEP conization. So again, here is 57522. You read all the information at 57520, but after the semicolon is going to be 57522 is what you want. You don't want the code knife because we didn't use code knife. And then we see it has a 90-day global period, so follow-up day. So because this patient has 90 days, we should not be billing anything within that 90 days because whatever would happen, like if there would be a complication or something like that, it should be included unless you're having to go back to like the OR for some reason. And that's like per Medicare guidelines. So like if the patient comes in for a follow-up just to see if everything's okay, that's not, you don't get paid for that. That will be a 99024. But because this patient has an anal genital wart that she wanted removed, which has nothing to do with the cervix that they did the conization on, we can actually bill for it. So that is going to be the 56501. And then we're going to use modifier 79 to show that this was an unrelated procedure. And then our code is actually here at A63.0 for anal genital warts. I know that was a mouthful, but I hope you guys understand. And I think that was it. I know I have more stuff on my notepad, but I'm going to end the video here. So that way I kind of have some more to go over with tomorrow. And actually this code that we just built has a 10-day global period. So I know when you have like a new global period or like something else that's a build within the global period, I think they say something about like it resets, but I'm not sure if that 90 day from the 57522 resets and she gets an additional 90 day, or if we have to get through this 10 day and then the 90 day. I'm not sure. Don't ask me because I'm not familiar with all that. I just know that there was 90 days with the 57522 and now there's 10 days with this. So I'm not sure how the global days would reset for the 57522. But if you know, feel free to leave it in the comments. That's it for today's video. Thank you all for watching. I'll see you in my next one.